Hi, my name is Doubleday. I'm a doctor of physical therapy, and I'm here today to talk to you about why seniors need to do balance exercises. Falls are a leading cause of injury in older adults, so we really need to address this. It's not a normal part of aging to have falls. So if you are having falls, you need to seek attention. It could be a warning sign that there's a medical issue going on, or that you are starting to get some weakness and some problems that really need to be addressed by a physical therapist or your physician. So let's take a look at, just real quickly, about some of the factors that can contribute to a risk of falling. It could be environmental factors, things that are going on around your house, things that you choose to do because you're a really active person, like getting up on a step ladder, right? We all know, be very, very cautious, or do not do this. Hire it out, okay? Other things are little things that are around us all the time, like a rug that has an edge that we could catch our toe on, or a cord. Your stairs, if you don't have a rail on your stairs, those steps could be much more difficult to do. So you want to keep an eye out for those kinds of things. Also, there's a lot of personal risk factors, right? So things like getting weaker or having a difficulty in your balance reactions. The less we exercise and do tasks that cause us to react to balance, the less capable we are of reacting when we catch our toe, say on the carpet or a rug or something like that. Also, there could be foot problems, right? So you might have some foot pain or foot deformities or really bad shoes that make you shuffle your feet and catch your foot on the edge as you go in and out of a doorway. So really take a look at these things. Also, people can have dizziness issues, right? So things that make them dizzy and lose their balance, or just get lightheaded sometimes when you haven't eaten well. Also, there's some medical factors, right? There are medical conditions that can give us that lightheaded and dizziness. So we want to take a look at medications. A lot of medications, and almost all of them, have a possibility of a side effect of dizziness. Okay, so these need to be reviewed with your doctor if you're having sensations of dizziness. Or you can have an issue with fainting or lose consciousness. That can happen with cardiac conditions or a multitude of things. So this needs to also be checked by your doctor. Also, vision. This is a really, really common issue, right? Vision and hearing loss. It makes you less aware of your environment. You might not realize something that's on the floor, or you might not hear someone coming behind you and you might get more startled. So hearing and vision issues can be a very important thing to address, even for balance issues. Then we also have some things that happen with incontinence, right? If you have bladder control problems or any incontinence, you might have to rush to the bathroom. That's a really common thing, and if you get up quickly and you get lightheaded, you could be at higher risk for falling down. So try to take care of those issues, because they can not only be just an inconvenience, but they could be a source of problems causing a fall. And then we have memory loss issues. People who do have confusion or disorientation or just forgetting how to get around or where you are, memory loss, even in a subtle way, can cause an increase in falls. Okay, so now that's a lot of things to think about. I want you to talk it over with your doctor. If you are having problems, you feel imbalanced or unsteady, this is the time to get help from a physical therapist, because we deal with this all the time. We sort through all of these issues that are going on in each individual person and determine which things need to be addressed. You might need to practice reaction balances. You might need to strengthen. You might need to work on those foot problems, stretch your really tight calf muscles. There's a whole multitude of things that can be factors that are affecting your ability to balance and decrease your risk of falls. It is very difficult to completely eliminate falls. People do sometimes fall. But we need to know and understand the factors that are happening behind it and reduce our risk in any way that we can. Okay, now we're going to do a few little tidbits of balance exercises just to let you have an idea of what kinds of things you can do today to get started. Physical therapists and other clinicians use several different kinds of tests to figure out if you're at risk for falling. So I wanted to just give you a couple of these exercises that you can do that they're similar to the things that we do on testing. So you'd be familiar if you go to a physical therapist on what kinds of tests you might do. So the first one, the most simple thing to practice, is getting up out of a chair. We have videos on how to get out of a chair properly, but I'm going to quickly go over it with you right now. So when you're sitting at a chair, what you want to do is separate your feet wide, sit at the front of the chair so that you're ready to move. You want to lean forward at your hips, and you can even use your hands to help you up at first. Lean forward, get your weight on top of your legs, and then your legs can push you up. And make sure as you come down that you are using your legs the whole way so you slowly control yourself down into the chair. And you're going to do this repeatedly, okay? So it's going to work on your strength. It's going to also work on your balance because you're transitioning and you're moving. Anytime you're moving and changing your weight, you're working on your balance. There are ways to make it harder, right? You could reach your hands out in front of you. You could hold a little weight in your hand to make a little bit more load for your legs. But doing them in a repetitious way works on your conditioning, your strength, and your overall stability. The other thing we can do in a chair, and this is not a normal test thing, but we could also practice our weight shifting. We could lean wide and reach across our body. And reach across our body. So you're loading one leg more than the other, and this helps your balance in the chair. Because when we reach out for something outside of our base of support, we can definitely feel that we have to balance ourselves there. So that's another one that you can do easily in the chair. You can also march. Marching in the chair also gives you that little bit of weight shift and helps you activate your trunk muscles and learn where your center is so that you stay controlled in the center of the chair. Okay, now the other thing we're going to do is I'm going to show you how to go to a corner. The corner is a really good place to have a safety zone around you so that you can challenge yourself. Balance gets better by challenging your balance. So let's do it. So you're going to come onto the corner, find a corner that has not too much stuff on the wall or things around you so that you have boundaries here. And then the chair can come right up in front of you. So you can have the chair close or a little far away depending on what activity you're doing. So let's find our safety zone here in the corner. We can put our feet really narrow and just stand. And if I needed to, I could hold my hand out and catch the wall. So you can do narrow-based balance. We can do one foot in front of the other one. We can also do one leg balance, letting go as you can, thinking about drawing up tall. And we can also do our marching here. It's really good. One of the tests we do for conditioning and balance is high knee lifting and seeing if you could do, how many you can do in 2 minutes. So that's one that you can practice on working up towards being able to do that for a full 2-minute time. One leg balance is one of those tests that we do to see how stable someone is in one leg. It's really important when you're walking because you are on one leg for a split second before the next leg touches the floor. So single leg balance is a very important sturdiness item to practice. Okay, so these are a few things for you to work on in preparation for talking to your doctor and talking to your physical therapist on what you can do specifically for your problems in balance and your risk for falling. So take time to practice some of these, and we'll see you on another video. Thank you.